Hello, everyone. Today, we're going to go over my speech on mental health awareness in the United States. Kristen Bell says, anyone can be affected, despite their level of success or their place on the food chain. In fact, there is a good chance you know someone who is struggling with it, since nearly 20% of American adults face some form of mental illness in their lifetime. So why aren't we talking about it? Today, I'm going to talk about the importance of knowing the risks of not taking mental health seriously in the United States. Mental health affects everyone, not just the person in crisis, but also the people who care for and love those people affected. Many people in crisis do not have access to the care they truly need. So many go untreated, causing them to become unstable, putting both that person and everyone around them in danger. Today, I will be talking about how that lack of care can affect everyone and how this often leads to unfortunate situations. Growing up, mental illness was disregarded in my home. Today, as a concerned parent, I have witnessed the lack of care and training in our mental health system. My son is currently in a mental hospital, struggling every day. This firsthand experience drives my urgency to address this issue. To put things into perspective, I want you all to close your eyes for a moment and imagine your 10-year-old son. He is your world, with his adorable dimples when he smiles and his big, bright brown eyes looking at you with such love it melts your heart. He has a psychiatry appointment today, and missing it means you won't have his necessary medications. You've seen him struggle in school, unable to make friends due to his anxiety. This anxiety often leads to violence. You're explaining this with all your heart to his psychiatrist. You've tried therapy, medications, and programs meant for his mental health, but he is still in crisis. The public school system is not equipped to meet his needs. So almost every day you get called to pick him up from school. You have now lost your job again. This is not just my story, but the reality for many parents. In this speech, we will discuss the mental health crisis in the United States, the lack of treatment and cost-effective care, the consequences of inadequate care, and examples of successful approaches to mental health from other countries. To understand the magnitude of the mental health crisis, let's start by looking at the number of people affected in the United States today. Nearly 6 out of 10 adults who rate their mental health rate it as fair or poor. They say they haven't been able to get the much needed care they need. For those who have gone without help, the most common reasons cited were lack of time, affordability, and fear of seeking care due to embarrassment are the most common barriers. Over 1 in 5 US adults live with a mental illness with various degrees of severity. The lack of understanding and inadequate mental health infrastructure contribute to this crisis. Nearly 130 million people in the United States live in an area with a shortage of mental health providers. Mental health services include inpatient treatment with counseling, outpatient treatment with counseling, and prescription medications for emotional, nerve, or mental health problems. In 2021, 47.2% of adults with any mental illness received mental health services, with a higher percentage among females at 51.7% than males at only 40%. Among adults with any mental illness, the percentage of young adults aged 18 to 25 who received mental health services was only 44.6%, much lower than adults aged 26 to 49. Many adults and children struggle with mental health due to the lack of care. As a parent, I've experienced the shortcomings of schools in dealing with my 10-year-old son who has depression, anxiety, PTSD, and is on the autism spectrum. In rural areas, schools often lack resources and no longer provide a set of teachers for special needs children. It took my son being long-term hospitalized before he received an individual education plan, or IEP for short. What challenges in school-based mental health services? The mental health provider shortage and inadequate funding are persistent challenges in school-based mental health services. 96% of public schools offered at least one type of mental health service in the 2021 to 2022 school year. The most frequently offered services include one-on-one counseling or therapy, case management or coordinating mental health services, and referrals for care outside of the school. Only one third of schools provide mental health screenings for all students, despite it being a best practice for identifying students' needs. The reason for this lack of screening? Schools often do not offer universal behavioral health screenings due to a lack of resources, difficulty accessing providers' data collection and maintenance burden, and a lack of support from school administrators. This problem extends beyond lack of care and the cost. Proper training on handling a mental crisis is crucial. Many mental health workers and first responders, such as the police, are not adequately trained. This results in abuse and even death of individuals in a mental crisis. People with mental disorders have a significantly higher risk of becoming victims of abuse than the general population. Within the mental health system, most commonly reported incidences were theft at 40% of patients, sexual assault with 10.6% of patients, and physical violence on 27.7% of patients, often by staff. In my son's case, he has had his toe broken, his ankles held down so tight that they collapsed into his feet, and has been sexually assaulted, all while in the care of mental hospitals meant to help him. Often, when someone is in crisis, the police are who are called first to the scene. People with untreated mental illness are 16 times more likely to be killed during police encounters. Training officers to handle mental crisis is essential to prevent these tragedies. Other countries have implemented successful approaches to mental health, providing valuable insights for improvement. Sweden, for example, prioritizes mental health across the population, not just in severe cases. Sweden has green spaces, work-life balance, and generous government spending on mental health. Policymakers, policy implementers, and individuals affected by a policy change have increased their knowledge within the mental health field to explore and analyze the development of a broadened mental health policy in Sweden. By doing that, Sweden has made it so it has the top positive mental health index in the world. Mental health in Germany provides a blueprint for other countries to follow. What makes Germany different from the rest of the world? Is Germany's level of commitment to finding and treating the mentally ill. Those who suffer from a mental illness in Germany have a vast support system provided to them by their government. Germany runs programs to ease the transition from a mental hospital back to everyday life. Germany has a program that provides the mentally ill with jobs. Germany also has roughly about 270 mental health hospitals and sufficient healthcare workers to assist patients. Perhaps the most effective strategy Germany has employed is its campaign to remove the stigma of mental illness in German society. The examples from Sweden and Germany show us that prioritizing mental health leads to better outcomes. Now let's consider how we can implement similar changes in the United States. Today, we discuss the mental health crisis in the United States, the lack of treatment and cost-effective care, successful approaches from other countries. In the great words of Dr. Noman Spencer, mental health is not a destination, but a process. It's about how you drive, not where you're going. It's time to prioritize mental health in our society, ensuring accessible and affordable care, proper training for mental health professionals and law enforcement, and learning from successful models in other countries. Together, let's create a future where mental health is taken seriously and everyone can receive the care and support they deserve. Thank you.